Hello, everyone, and thank you so much for joining our event today. My name is Chris Collins, and I'm president at Friends of the Global Fight Against AIDS, TB, and Malaria. Thanks for joining us for this web event titled Health as a Catalyst for Women's Equality, an Agenda for Action. I want to thank CARE, Global Health Council, and the International Center for Research on Women for co-sponsoring today's event with Friends. Thanks also to Lois, the President and Executive Director of the Global Health Council, for serving as our moderator today. Also, a particular thanks to Lenice Williams, Friends Advocacy and Partnerships Manager, who spearheaded this event for us. We're here today to discuss the health needs of adolescent girls and young women and how COVID-19 is disproportionately and devastatingly impacting their health and well-being. We want to talk about the virtuous cycle of health services and women's empowerment, how health services can advance women's equality, and how women's equality advances health. We'll examine how the work of the Global Fund to Fight AIDS, TB, and Malaria, PEPFAR's DREAMS program, and other U.S. bilateral programs are helping empower girls and women vulnerable to the most devastating infectious diseases. In particular, we want to share concrete actions U.S. policymakers can take to advance adolescent girls and young women's health and rights. Now, I'm pleased to introduce our featured speaker, Congresswoman Lois Frankel. Congresswoman Frankel represents Florida's 21st Congressional District. She's a real hero to us. She's a leading advocate for women's rights, gender equality, health care, and LGBT issues, and she has been really for her whole history, including her time in the Florida legislature. She's a member of the State Foreign Operations Subcommittee on Appropriations in the House and the Congressional Caucus for Women's Issues. The Congresswoman will speak for a few minutes, and then she'll have time for about 10 minutes of question and answer with you. And if you have a question for the Congresswoman, please type that in the Q&A box on the right-hand side, and I'll read as many questions as we can get to. With that, welcome, Congresswoman Frankel. Thank you for being with us, and please go ahead.
Thank you, Chris, and for your kind introduction. And I am really thrilled to be joining virtually with the great representatives of these wonderful organizations. I think we have the Friends of the Global Fight, the CARE, the Global Health Council, International Center for Research on Women. If I missed anyone, I still love you. One of my most memorable trips I've ever taken in my life was with CARE to Nairobi and Malawi to see what they were doing to advance, especially women and girls. And I'm really looking forward to hearing from all of you. The U.S. has been, I will say, up until probably recently, maybe I can say this, we've been investing in a global leader, investing in women's healthcare, education, empowerment. I know it's been a disappointment, I'll say at least for me, how this current administration on these issues. But I think all of us know that on this panel that threats to women abroad are threats to us at home. And this is especially clear today as we grapple with the impacts of COVID-19, a disease that reminds us how threats across the world can quickly impact life here. And that's true of pandemics, it's true of terrorism, it's true of gender discrimination. And I'm going to just say something that I say over and over, that when girls and women are healthy and educated, economically empowered, societies as a whole are more peaceful and more prosperous. So, of course, I'm going to be interested in hearing what you think what more Congress should be doing. And let me start offering a few thoughts. Absolutely, we should begin including robust funding for the international response to the COVID-19 in our next appropriations package, and if we have another COVID package. A global pandemic requires a global response. And just to let you know that my fellow Floridian, a Republican, Francis Rooney, we've been working on a letter to leadership urging funding for USA, State Department, and other critical development agencies. We also have to, I say double down, triple down on our commitment to advancing women's empowerment. Women and girls are disproportionately impacted by this pandemic, as I'm sure you know, especially in developing nations where the disease outbreak threatens their health, access to education, livelihoods, and overall safety. And just as many of us are champions for women's rights here at home, we must do the same for women abroad. And I am telling you that I am prioritizing these issues as a member of the House State and Foreign Operations Appropriations Subcommittee. As we look to the next fiscal year budget, issues like funding for family planning and reproductive health, maternal and child health, the UN Population Fund, girls' education, empowering women to take on roles in countering violent extremism, conflict prevention, and peace building, women's economic empowerment, addressing the gender-based violence, because we've seen that, especially domestic violence, we've seen a rise with the COVID. And absolutely, we have to take on the global gag rule. And it is a mission for Democrats to permanently repeal the global gag rule, which is needlessly hurting women and girls around the world. And it is unconscionable that in the midst of a global pandemic, that the U.S. is blocking critical funds to clinics and health facilities around the world because they may even indirectly reference abortion services. A recent GAO report found that the global gag rule, since being reinstated and expanded under the Trump administration, has denied billions of dollars worth of global health awards. And I would like to hear your response to that, because I've heard anecdotally that clinics have closed because of that. But this impacting health services that, HIV, AIDS, family planning, reproductive health, maternal and child health, tuberculosis, and even nutrition programs. And I know that a future Democratic president will reverse this destructive policy, but in the meantime, we have to figure out what we can do about it. I heard today a very disturbing report. I was just on a Zoom with, or some kind of virtual meeting with the King of Jordan, and he talked about a real concern about food security. He thought that a wheat shortage was going to hit developing countries in the next year or two, and he was very, very worried about that. So I just put that on the table too. In any event, just to wrap up, a couple of things that I've been working on: women's entrepreneurship and economic empowerment, which really devotes resources and policies to helping women with economic empowerment. I think that, I'm sure how the COVID is affecting that, I'm sure not in a good way. We've just got the Women, Peace, and Security implementation plans from USAID, which we hope will further entrench a lens of gender inclusion and empowerment into our foreign policy. I've been working with Republican, again, Mike Waltz, on a new caucus called Women, Peace, and Security. And obviously, I know this is going to be a talk, especially about our young girls. We've got to fight to reduce the barriers girls are facing in primary and secondary education. We have a bipartisan Keeping Girls in School Act, which authorizes a new USAID funding mechanism to reduce specific barriers adolescent girls face. The bill did pass in the House, yay. It's sitting, of course, on the desk of Mitch McConnell. So listen, those are just a few of the things I'm working on. I'm really more interested in what you're working on and taking your questions.
Well, thank you, Congresswoman, and again, thanks for all your great work. You can now ask questions of the Congresswoman by putting questions in the Q&A box on the right-hand side of your screen, or I can probably see them if you put them in the chat box, the two different options there. But please go ahead and put any questions in. We have about 10 minutes for that. Congresswoman, I don't have a question yet, so let me ask you, you've talked about some of your priorities in terms of women and girls equality and in terms of, action on the House. We'll just really be interested in your sense about, in terms of your colleagues in the House, how is their appreciation of these issues changed over the last couple of years? Have you seen sort of trends and sort of an awakening among many members of Congress around these issues? Where do you think we stand with that and your colleagues?
Well, I can tell you, I believe the issue that is getting the most attention of these issues right now is the global gag rule, because of what we have heard, at least anecdotally, and now from the GAO report. I do believe that there may be at least a move in the House to remove that language from any appropriations bill. We haven't done that in the past, only because we know it's a non-starter with the Republicans. So, and who, of course, are in this control the Senate. So anytime you put that in a bill, you slow down, perhaps you slow down this progress. But the fact of the matter is, you ain't going to have to go to some kind of conference in any way. So I see that as a real possibility. And hopefully there is a new enlightenment since apparently the COVID started overseas. I hope there's a new enlightenment that we have to care what goes on health-wise in other countries. I do think that even with the Trump administration, which has been pretty lousy, that's a polite way of saying they've been terrible on most women's issues. At least I think Ivanka Trump has recognized the empowerment issues, although where I think they have fallen short is not wanting to include access to health care and reproductive care in any of their initiatives. So, but that's where I think we are in terms of Congress.
Thank you. Okay, we've just gotten a flurry of questions in for you, which is wonderful. Would you mind if I asked like three at a time and then you respond? Would that be okay, or should I do it one at a time?
I don't care. Try. You'll see how good my memory is.
I'll good.
Write down the questions.
Great. Okay. So from Gayatri Patel, Congresswoman Frankel, could you speak to the issue of gender-based violence and how the U.S. Congress can play a role in addressing the impacts of gender-based violence, particular concern with gender-based violence and humanitarian emergencies? That's one. A second is, how likely do you think it is for international assistance to be in the next COVID stimulus bill?
Oh.
And another one is, I'd appreciate more elaboration on the Keeping Girls in School Act you mentioned. What type of funding are we seeing? How is this going to encourage or protect girls attending school?
Okay. Let's see if I got this right. Well, I think we're dealing with gender-based violence in different ways. First of all, we definitely have to put more money into work, probably with our NGOs on that issue. There's been a lot of domestic violence, as I mentioned. We're also, with the Women, Peace, and Security, recognizing the role of women in terms of where there is, terrorism and violence. The participation women, sometimes they're victims, sometimes they're participants, but they are definitely influencers. And so that is something that I know that we're looking at. And this new, I haven't had a chance to read. It's a long report, the implementation plan. But I'm hoping that there's going to be should be efforts to, at least in that regard, to try to reduce the victimization of women, and also to assist women in being participants in keeping the violence down, keeping their communities safe. On the COVID, I think I just I know Representative Rooney and I are advancing a letter that we're going to circulate to our colleagues, requesting that the funding for international funding for COVID be included in the next pandemic bill, if there is one. I mean, we can't even get our cities and counties cities and the states taking care of it. I mean, really, the roadblock is the Senate, as you probably know. It's really a horror show dealing with them, but to put it mildly. But we are going to make an effort. There will be an effort on that. There is I think Josh is on the, and I have some staff on the call with me. I'm going to have them send me a text, but I know that we did ask for an appropriation for the Keeping Girls in School, and I'll get you that exact figure. But it's really it encourages USAID to really focus on some of the barriers that are keeping girls out of school. I mean, now, truthfully, when we wrote this legislation, the pandemic was not we were not even thinking about it. So obviously that's going to play a bigger role right now.
Wonderful. Okay, thanks. Do you have time for another round of three?
Yeah, go ahead.
Sure. So my name is Pravita Singh, Acting Executive Director at Girls Health Education. And my question is, in light of COVID-19, how can we make sure that remote learning measures are equitable towards most low-income girls? That's one. Okay. Another is from Lauren N. What impact do you think the U.S.'s recent cuts or proposed cuts to the WHO funding will impact the work and efforts in this space, what we're talking about today? And a third one is, could you speak more to your support for efforts for additional funding for USAID in support of women and girls, especially under COVID?
Okay. Okay, let me think. I think I forgot the first question. Okay.
Remote learning.
Okay. Was that internet? Okay. So I think, I mean, that's a good point. I mean, I think part of the issue, I'm going to look forward to listening to you all. You're talking about remote learning overseas. Yes. Yes. Okay. Well, I think that goes to the issue whether or not that is obviously that's a good issue to bring up, because I mean the first question is there actually internet service or any kind of infrastructure for remote learning? And I would suggest that should be one of the areas that we need to look strongly at and fund, because obviously you cannot have virtual learning if you don't have the infrastructure. The other question I think you had a question on funding for USAID. Well, just to know, I mean, I've always been me personally, I'm a very, very strong proponent to not only, funding USAID and funding actually the NGOs that work with USAID, because I do think that is type of diplomacy that we really need to bring peace and security to the world. So, despite the fact, listen, the president tries to cut everything, and the good news is that Congress rarely accepts any president's budget. So much less this president's budget will not be accepted in the Congress. But I am concerned, from what I've heard, there's not a lot of extra money floating around. But I mean, I know you can count on myself, and I'm sure even, Nita Lowy, who is our chair of the SFOPS committee, that we understand the importance of continuing our outreach and in overseas. And I don't know, you might have had one more question, but I can't remember it.
We had USAID, remote learning, and WHO.
Oh, okay. I did the remote learning, of course. We need to make sure there's infrastructure. WHO, I don't know what the president is thinking. I mean, it appears that maybe WHO made some errors. I don't know. This was a new pandemic, but the fact of the matter is, this is no time to cut off cooperation with international partners. That is just plain dumb. And I know that where Congress can resist that, we will.
Great. Well, thank you, Congresswoman Frankel. We're at the end of the Q&A portion, but we'd be thrilled if you can stay with us. Maybe we could circle back to you if you can.
Sure.
But again, I just want to thank you for your great leadership and for your time today. We really appreciate it. With that, I would like to hand over the balance.
I want to say one thing. Thank you. I am going to listen, but I will probably go check my video so I can eat my lunch while I'm listening, because I've been on Zoom meetings all day, okay? So I just want my brain to work while you're talking. But thank you very much, and I am going to listen very carefully.
Fantastic.
Okay.
Thank you. And with that, I'd like to hand over the balance of the meeting today to my wonderful colleague, Lois Pace, who heads Global Health Council. Lois.
Thanks very much, Chris, and thanks as well to the Congresswoman. We can all relate to that Zoom life, especially with events that run over the lunch hours. So appreciate her time with us as well. And again, we just want to keep this conversation going. Thanks to many of you who already have been engaging in the chat box or offering your questions. We certainly welcome those throughout this panel discussion. But essentially, I really want to pick up where Chris left off and have a number of speakers who have joined us today really share their take on what the U.S. is doing on the ground in countries around the world, as well as what's still needed or required for us to take action, not just as advocates, but as policymakers and decision makers. As Chris mentioned in his opening remarks, there's such a need for us to really pay attention to what's happening with women, and in particular adolescent girls, in light of the pandemic. As we know, health is wealth, and health outcomes really drive prosperity and equality. But the reverse is also true. So I think it'll be important for us to dig into some of the intersectionality of these issues and kind of examine the cube from all sides. So again, grateful to have this group of speakers here with us today. I will go ahead and introduce them, at least by name and organization. I understand that all of the attendees did receive links to their bios online, and so hopefully you'll be able to reference that link so that you can learn more about this all-female panel, which I'm proud to be part of. But first, just going in alphabetical order by last name, we have Dr. Angeli Achrekar. She is the Principal Deputy Global AIDS Coordinator at the U.S. Department of State, and has been there for a number of years, and can speak to, again, the work of PEPFAR and other U.S.-driven organizations in countries in service to women and girls. We have Dr. Roopa Dhatt, who is the co-founder and executive director of Women in Global Health, a pretty powerful worldwide movement advancing leadership of women and young women in particular in the global health space. We have Janet Fleischman, who is a senior associate at CSIS, that's the Center for Strategic International Studies, and their Global Health Policy Center, who again has been working in the women's health policy space for a number of years, and I know will offer some insight as to not just health issues, but sort of the ripple effects of COVID and what that means for women and girls around the world. And rounding things out, we have Dr. Jennifer Cates, who is the Senior Vice President and Director of Global Health and HIV Policy at Kaiser Family Foundation. And finally, Maureen Marenga, who is a board member at the Global Fund to Fight AIDS, TB, and Malaria, as well as the executive director of Lean On Me Foundation. I think a lot of us know Maureen and admire her work and her commitment, again, to this issue, particularly as it relates to HIV and TB, but the range of human rights issues for women and girls in region. So with that, I want to welcome each of our speakers and thank them again for being with us. And I think to kick things off for the panel discussion, I just want to ask a general question to the group that's assembled. You know, when we step back, I mean, just with the Congresswoman's remarks even, there's just so much to this issue of women and girls and how they are being affected in the age of COVID. And again, what more is required to really support their advancement. But if you could just take one piece of that puzzle, right? If you could wave your wand and solve one of these problems, I'm really curious what that would be. So I think I'll go ahead and start with Angeli. And again, what's one health problem that you would solve or one barrier that you would remove to help us move towards advancing the status of women and girls?
Great, thanks very much. I hope you can hear me okay. Great. First, let me start off by thanking all the organizers for this incredible event. It's so timely. So Friends of the Global Fight, the Global Health Council, CARE, and ICRW, just really grateful for you all taking this time to host such an important event. I also want to thank Congresswoman Frankel for your support of this issue, this incredibly important issue, and your longtime support of PEPFAR over the many, many years. We are so grateful to have your support and that of your other colleagues on the Hill, and in a bipartisan way for the past 17 years. It's been extraordinary. I'm really humbled to be on this panel with such wonderful women that represent really the swath of all the incredible work that is going on. And then again, to really just be able to carry the voice of the millions of adolescent girls and young women that we are privileged to serve through PEPFAR. And so let me talk a little bit about that and then answer your question specifically, Loyce, about if I could wave the wand, what would I focus on? So again, with dreams, this opportunity to really focus in on adolescent girls and young women, we've really been able to reach and touch the lives of so many adolescent girls and young women. But I think and I'll talk more about that later, but I think to your point, the one thing that is pervasive and continues to be pervasive, not only in the pandemic of HIV, but in the dual pandemic of COVID-19, but everywhere around the world, is just how disproportionately at risk they are. You name the issue, they are disproportionately at risk. And I think the one piece that really continues to kind of interface in all of these various spheres where we work is stigma, discrimination, and these gender norms that really continue to put them at risk more so than their male counterparts. And so I think if we were able to wave the wand and really begin to start chipping away at this, it would be in that space.
Thanks very much, Angeli. Roopa, how about you?
Right, thanks, Lois. Really, I think the one place that we really need to think about really waving the wand is how we actually view girls and women, especially in the health sector. We continue to see them as vulnerable populations. So I'd say the one place we really need to invest is really changing the narrative and starting to see women as truly the drivers of health. Women make up majority of the health workforce. They're 70% of the health workforce, but when we look globally at the numbers of where women are represented in senior leadership in global health, we know those numbers are only 25%. When we take a look at the health and social workforce, 50% of what women do in the health sector remains unpaid, which amounts to $1.3 trillion US annually. So really this conversation about gender equality about engaging girls, engaging young women who are going to be entering into the workforce. It's really about seeing them as really levers of change. And that magic wand would be ensuring that they have decent work, that they have decent jobs, that they're protected, and that they aren't facing any violence, they're compensated, and they truly are valued.
Thanks, Roopa. Janet. Sorry, Janet, we can't hear you. I think you're still muted.
Apologies. Is that better? An honor to be on this panel with all of you. And I would say the magic wand, if we would have it, would have to relate to figuring out how to do multi-sectoral programming and effective integration that really addresses the needs of women and girls, because their lives are not lived in silos. You could say that interventions about sexual and reproductive health and access to contraceptive commodities is one enormous piece that they need, but it's not the only piece. And one of the things that the HIV epidemic and now COVID have shown is that the issues, the social and economic issues combined with the health issues that put them at risk of these pandemics are exacerbated in times of crisis. So access to education, the risk of gender-based violence, the economic meltdown that we're seeing, and the rise of transactional relationships, survival decisions because of that, the broader issue of access to SRH services and family planning and STI screening. These are the range of issues, among others, that adolescent girls and young women face, and without really addressing their needs, without listening to them about how they see the importance of these issues and how they best access that information and those services, then we won't be able to put in place the kinds of mechanisms that they can access that will be protective for them. And COVID puts that in very stark relief right now, because the very issues that put them at risk of HIV are now exacerbating their risk of COVID. And all the investments in DREAMS and the important work that the Global Fund and national campaigns have done could be put at risk by this new pandemic. So there's a lot of work to do to keep the focus on this population.
Thank you, Janet. Jen, what keeps you up at night?
What keeps me up at night? Well, first, before I get to that, just again, I want to echo everyone's, thanks for inclusion on this great panel, and to see everybody and be here. It really is an honor. I'm glad you asked me a slightly different question, because everything I've heard so far I agree with. I think there's a lot that keeps me up at night. I'm sure everyone listening has that same experience. But in thinking about adolescent girls and young women, I mean, one of my big fears is they are just, because everyone is focused on the crisis of COVID, they are being forgotten. And when you first asked the question about what magic wand would I wave to do what, it would really be, in addition to the multi-sectoral approach, thinking first and foremost, what do women and girls need as the starting point for designing interventions, which is not how interventions are designed. And that is not at all what's happening with this latest pandemic. And so what keeps me up at night is I'm thinking about all the young women and girls that are not able to go to school. We know that school is a place where there is not just learning, which is what is so fundamental for improving the status of women and girls, but also safety. And most schools in low and middle income countries right now are closed. So that access point is cut off. As Janet mentioned, work opportunities right now are not available because of shutdowns in most places. So I'm really worried that they're suffering in silence, and we're not able to hear them because the access is not there in this current outbreak. I know that there's many people working to change that, but I think that we have to be aware that is happening, and it will just exacerbate the very challenges that they face. So when we exit this moment, out of ground to make up.
Thanks for that, Jen. Well, I think we have in Maureen someone who is trying to turn that around and make sure people don't continue to suffer in silence. So I'd love to hear from you, Maureen, what you see as a sort of magic bullet when it comes to solving this problem. But if you could also speak to what you're seeing on the ground, right, and what we might not have a view of from here in Washington.
Thank you very much, and thank you to the organizers, presenters, and the participants who are here, and mostly to the Congresswoman for your really, really thoughtful and very powerful remarks. And you're welcome to Nairobi once more. So I'll begin with the one thing that if I would change today, I know there are numerous, and everything that people say, I would want that changed, but also the economic impact of seeking health services. I come from a country where you have to pay for almost all health services unless they are donor funded. And this gives women a lot of burden. We have seen women dying trying to give life because they couldn't afford to deliver in hospital. We have seen poor women made poorer because someone in their family or they themselves were sick or they needed some form of health services. And so this is quite a challenge, and especially to young women and girls who have no economic income at all, it becomes even more complicated for them to seek services, and especially sexual and reproductive health services. And those who have spouses have to seek permission because they can't afford to go to hospital. They have to seek permission from their spouses and resources to go to the facilities. And I think this is one thing that if we could change and the woman decides how to run their health and that of their families, then we would really have a better place to be. In relation to COVID-19, we have seen some of these challenges escalate because previously we knew that women and girls faced considerable challenges in accessing health information and services, and this has been made even complicated with the restriction of movement, lack of access to information, lack of resources to seek health services. We have seen very devastating consequences. We have school closures that have been mentioned here and lockdown, and this is leading to a shadow pandemic, because we've seen rising cases of gender-based violence and rates of child marriages, teenage pregnancy, and female genital mutilations. And these we estimate that they will go even higher, but they also we don't have a way to, the victims don't have a way to seek redress because they cannot move, they cannot reach where they can get help. And I think more young women and girls will die not because of COVID-19, but because of lack of services, sexual and reproductive health services, and unresolved cases of gender and sexual violence. Then there's the issue of food security. So many people are going without food, and many people have one meal a day. Women are the ones who are stressed with the burden of care, especially those who have children. And it's really difficult to tell your child that I lost my job because I can't go anymore. I need to keep distance, and therefore you guys are going to go without food. And so that burden lies mostly with women than with men, because it's the women that spend most of the time with the hungry children. And then we also have the many unreported cases of rape and reduced. We have a PEP policy that is very difficult. So for a woman to seek post-exposure prophylaxis services, they have to go to the police to report cases of rape, and then they have to see a doctor to verify that they were actually raped before they are given post-exposure prophylaxis. So all these avenues have been blocked by the restricted movement, and therefore we have many cases that we cannot support. So because of the school closure, again, girls are limited to house chores. They are doing housework. They are not really studying at home, despite the fact that government is assuming that people are studying at home. And I think chances of going back to school will be more difficult because parents and other people who are caregivers will be comfortable with them staying at home. So this is another challenge that we are facing, and so many of them are also being sacrificed to marry so that families can survive. the COVID-19 lack of job and lack of income face. So I think these are some of the huge challenges that are taking away all the gains we have made in terms of supporting women and girls. Yeah.
Yeah. Well, thanks for that. It's a sobering account, but it's important for everyone to hear. So Angeli, I actually want to come back to you. You mentioned dreams, and I know that you're, available to provide more detail on that work. I think specifically as you do that, it would be really helpful to understand how Dreams is capable of addressing these issues for your target population, particularly given like the other stressors, I guess, on that group and on the program, and whether or not the program itself is, flexible enough to address a wider range of issues, if not all, of these risk factors that folks have outlined already in sort of the first 10 minutes of our discussion.
Great, thanks very much. I think it's these issues that have been discussed. Again, I think what we have at our fingertips in terms of building on strengths is this incredible Dreams partnership. When we talk about seeing the adolescent girl at the center of intervention, that is what this partnership is all about. That is what the programming is all about. It's a multi-sectoral approach, really recognizing all and adapting intervention to all of the various needs that adolescent girls and young women have. So while it is ultimately focused on HIV prevention among adolescent girls and young women, it is really rooted in addressing structural drivers that impact gender-based violence, opportunities of education, other things that you all on the panel have highlighted as critical for adolescent girls and young women. I think the other piece is, it's important to build on strengths, reach, and impact. The work of Dreams, now it's in 15 countries. We've invested more than $900 million since its launch in late 2014. It's a public-private partnership with a number of different innovations that private sector partners are bringing to bear. We interface hand in glove with the Global Fund in terms of implementation on the ground and with communities and adolescent girls and young women. So I think, Dreams really, and the programming of Dreams and the way that it is, again, I should say the impact of it has been extraordinary. Not only have we reached millions of adolescent girls and young women across the globe, specifically, in the majority of our work in Africa, but we are, through this partnership, through this implementation, actually seeing, HIV diagnoses declining in a way that we've never seen before. So again, I think building on the strengths, you've got this incredible broad-based program that exists specifically for adolescent girls and young women, focused on structural interventions, community-based interventions, school-based interventions, biomedical interventions, that's working. Let's use that as we move forward.
That's encouraging to hear. Jen, I know you've also spent a lot of time in your role digging into US programs like PEPFAR and others, as well as some of the multilateral partnerships that we've referenced today too. So can you speak to the same question of how you see those programs able to kind of reach this broad range of issues that women and girls are facing, particularly in the middle of a pandemic?
Great, thanks. So a couple of different points here. First, it's true. I think I don't know how many people realize, but the U.S. Government has been involved in addressing the health of women and girls for decades, almost since the beginning of its health and development work. Not that women and girls have always been at front and center of designing programs, but in terms of reaching people and beneficiaries, the U.S. government has been there and remains the largest donor today, providing a range of services through maternal and child health program, its family planning and reproductive health program, and of course through PEPFAR and other efforts. And I don't want to speak for PEPFAR and Angeli, but PEPFAR provides, or is estimated to provide, about $2 billion a year in efforts to address women and girls. And that's more funding than the combination of funding provided to maternal and child health and family planning programs. So part of PEPFAR and what it's meant and what it's trying to do and the challenges that women and girls and others face in HIV risk and need for treatment. But it also, I think, really speaks to the unique role that PEPFAR plays. So it brings me to my second point, which is DREAMS is sort of a model program to stand up and say this has been a new approach for the U.S. government. As Angeli mentioned, approximately $900 million has been spent or is being committed to that effort. That is a drop in the bucket, and too often I think the onus has been on programs like PEPFAR and the Global Fund because they have the largest budgets, which is important, but to take on the whole range of issues that women and girls face. So DREAMS is a multi-sectoral program. It is trying to knit together the interventions in the education sector, interventions in income generation sector, interventions in family planning, reproductive health, as well as HIV with an ultimate HIV goal. But that can't be PEPFAR's responsibility alone. So while the U.S. government is the largest supporter of programs and the largest funder of programs that reach women and girls, I'm not sure that they're being leveraged and packaged in a way that's going to have the biggest impact. DREAMS provides a roadmap for that, but it's one effort in the middle of a whole constellation of other programs. And I should say not just health programs. What about the education sector that USAID funds, agriculture, and others? That package needs to be complete to more fully realize the needs that young women in particular and adolescents face. So it's a good story in that the U.S. government is the funder and in terms of programs and services, but it's not necessarily being approached in a way that's going to leverage the best results. DREAMS is a model for doing that, but I think a lot more could be done.
Yeah, very helpful. Thanks, Jen. Marina, I want to come back to you, especially given your role on the Global Fund, and curious to know, you gave us a great account of what's happening on the ground, but I'm curious to know what you think are the opportunities for a Global Fund to help address some of those issues. We've heard more about PEPFAR and DREAMS specifically, but not as much about some of these international initiatives, and I think it would be helpful for others to hear your take on that.
Thank you very much. I think we all know that U.S. government is the largest funder of the Global Fund, and we really, really appreciate that. And Global Fund has really prioritized addressing gender and human rights barriers as an integral part of Global Fund's strategy. Global Fund has in the recent years steadily increased investments in programs designed to meet the unique needs of women and girls. And in most countries, we see the resources for women and girls complementing what DREAMS initiative is doing and trying to identify the gaps that are still there so that we don't duplicate services, but we ensure that we reach women, especially young women and girls, in their different needs. Global Fund in this current grant that we are implementing invested in what we call her Voice Fund, and this fund supported adolescent girls and young women in 13 countries in Africa through provision of small grants to community-based groups to overcome barriers to participate in Global Fund related processes. Now, we are encouraging young women and girls to participate in Global Fund related processes because we know Global Fund has the principle of country ownership. So we are hoping that these challenges we have identified, and with the empowerment of young women and girls to be able to speak out, countries are going to prioritize the immediate needs of these women and girls into the country grants that are currently being made to the Global Fund. Countries are now making application to the Global Fund, and we hope that the girls will have space in what we call the country dialogue to be able to speak out and ensure that their needs are actually turned into programmatic areas that can be funded. We also, Global Fund has also incentivized countries through what we call the matching grant to ensure that countries deliberately support or fund programs targeting young women and girls. And so with that catalytic funding, we are hoping that we will go beyond the biomedical needs and address the other social drivers of the epidemic. Because in most programs, we have so much done what we call treating the symptoms, but we don't get to the root of some of the problems and some of the vulnerabilities women and girls have. So through these initiatives, we are hoping that we are ensuring that countries actually prioritize resources in addressing those drivers of vulnerability of young women and girls to HIV and TB. There is also a focus on education, and this is complementary to the DREAMS initiative because we know it's also a powerful tool to preventing HIV among adolescent girls and young women. Thank you.
No, thank you, Maureen. Appreciate that. I want to come to Janet now. All this sounds pretty great, actually, right? Like we have these programs that can actually chip away at this problem, and yet we're still all convened to understand what more can be done or should be done. And so I'm just wondering if you, Janet, can perhaps shine a light on a couple of blind spots or areas that maybe you're still kind of getting left behind or, require some additional attention. I know you, as well as the Congresswoman, spoke earlier to sexual reproductive health rights, for example. Gender-based violence is another area, as well as sort of these other issues around nutrition or food security and education. So I'd really love for you to dig in a little bit more deeply to help us understand, like, whether or not those are areas that do require more attention or, anything else that might be getting left out of the way we're trying to solve these problems right now.
Thank you, Loyce. So as Angeli had described, one of the really unique features of DREAMS is that it has this layered approach that's supposed to include a range of different services that adolescent girls and young women in different age groups would be able to access. And that's a really important innovation of DREAMS. It's been complicated to implement, certainly complicated to track. It's always difficult to track referrals that a girl might get to a facility, for example, to get contraceptive commodities or information about other health services. So the broader issue of how do you implement these kinds of programs that are trying to be layered services and come together, and how do you identify which combination of these services might be the most impactful in a specific situation, because it obviously will depend on the population. Is it rural? Is it urban? Is it, what are the services around in the community? Are there services for gender-based violence that they can access? Is PEP available? Maureen was giving quite an interesting and sobering example of the difficulty of accessing post-exposure prophylaxis for a young woman or a girl. What are the issues of coordination, both between and among the implementers and the community-based groups that might be a part of this DREAMS package, and also, as Maureen and Jen and Angeli alluded to, how do you coordinate with the other donors and with the national programs? So coordination has been an issue, making sure that the layered services are really available and understanding which ones and which combination are most impactful. The broader issues of gender-based violence and both the prevention of gender-based violence as well as the services, the response to gender-based violence is always in our country as well. These are difficult issues to address, but are fundamental both to HIV risk and to the lives of many of these women and girls in communities where those services are not readily available. And if you look at the situation that we've discussed about education for girls now, with the overlay of COVID, So some of the services that they would have gotten from a school-based platform, they may no longer access, not only because the schools are closed now, but maybe those families are not going to prioritize those girls to go back to school, or the issue of access to sexual reproductive health and the needs that they have for information and services on family planning, hearing about the uptick in teenage pregnancies and the other issues that they're facing, in many cases could lead them to drop out of school anyway. So finding ways to prioritize their needs on the SRH services is going to be very important, and again, exacerbated by the COVID crisis. And I think overall, the big challenge right now is going to be maintaining the focus and the momentum. The U.S. through DREAMS has done a lot. There's a lot more to be done. Global funds initiatives and the catalytic funding, all that is very promising. But right now, as Jen had said, there's a concern that priorities are shifting, and that much of the focus and the momentum around adolescent girls, young women themselves, and the programs that are trying to serve them could be lost right now. And how do we make sure that we don't lose too much ground? How do we make sure that we build into the new COVID response the importance of focusing on these needs, even if adolescent girls and young women themselves are not the main people getting infected with COVID at this point or having the worst reactions to it? This whole myriad of issues is going to affect them in very unique and important and long-lasting ways. So making sure that the COVID response takes that into account, and that is a way to strengthen what the DREAMS platform enables us to do. But I think many people are afraid that it's a time that we risk losing the momentum and losing the importance of that narrative for COVID, for the HIV response, and for the importance of the lives of these adolescent girls and young women and their communities.
Yeah, Angeli, I'm hoping you can respond a bit to that, and really because you are so representative from the administration here. But I am curious to know if you're hearing these types of concerns from y'all's partners, and how you have been able to respond to that. Right, this even if just at a basic level, this concern of losing momentum, losing ground, stalling progress. Is that something you're hearing? And if so, what's your, what are you saying back to people who are waving that flag?
So with regard to, I'll step back just a little bit and go to where Jen was framing the PEPFAR investment since the beginning, focused on adolescent girls and young women, and it's well over $2 billion. DREAMS is one critical program, but not the only program. I think when we look at and we serve adolescent girls and young women, it has to be comprehensive. It has to be multi-sector, thinking about all their needs. And there are two things that I just want to note because we haven't talked about it yet. And that is the importance of data and the importance of outcomes. When we think about data, even now in our programming, as well as we look into the future, it is absolutely critical that we need to continue to have age and sex disaggregated data so that we can focus in on adolescent girls and young women specifically, but not just adolescent girls and young women to 30, but what is it that a 10 to 14-year-old adolescent girl needs versus a 20 to 24-year-old young women? And then how do we tailor our interventions to address their needs? The other thing I want to note is related to outcomes. It is so critical that we, whether it's education, whether it's biomedical interventions, whether it's HIV, whether it's gender-based violence, we need to be focusing on impact and outcomes. Ultimately, what is it that's making the change for adolescent girls? So again, those are two pieces, but related to, these dual pandemics, tri-pandemics that are going on right now. How are we protecting our gains? From PEPFAR's perspective, we continue to prioritize adolescent girls and young women, and we have continued to increase resources to our programming for DREAMS, for example. We continue to, even beyond the 900 million, look for ways to continue to augment and increase that programming. Maintaining the focus and protecting the gains is really important. We're learning every day what's happening on the ground. As Maureen was talking about, what's happening on the ground in the communities where these adolescent girls and young women are living, in their homes. We're trying to adapt our intervention as we speak so that we can address the current barriers right now. So, for instance, web-based support, WhatsApp adherence groups, community groups through social interaction. Web-based social interaction is really important. So again, we're just trying to adapt as we understand what the real situation is.
Thanks for letting me come back to you with that, Angeli. I appreciate it. And I understand the Congresswoman wanted to come in as well. So open to hearing your thoughts on this too.
Really, thank you. I've been listening. My video has been going on and off. I don't know about that, but I have been listening to all of you. Thank you for your very wise remarks. I did want to comment before I leave on your discussion of intersectionalism. I think that's what you're calling it, which I absolutely agree with. You can't really separate out, whether it's genital mutilation or child marriage or the cultural obstacles to girls going to school or the legal obstacles owning property, whatever it might be. It's trying to look at all this, but I want to tell you what one of the obstacles is right now, and I think I sort of got to it before. I'm going to tell you a conversation I had with a very high-powered, influential member of the Trump administration on these issues. Because as I discussed the women empowerment legislation, which there's new women empowerment legislation that's been proposed, and I said to this person, look, you cannot just, if young girls don't get to go to school, if women are not healthy, doesn't matter how many laws you're going to change. A woman who's not healthy, a child who hasn't been educated, is not going to be able to take advantage of new resources and so forth. And what I was told was, I can't fight more than one issue at a time. And that's a subterfuge by saying this, is that the far right community has such a chokehold on this administration that we cannot get them to look at holistically at what's happening to girls and women in this world. So hopefully we fight through that. And I want to just, again, thank all of you for what you're doing on the ground, to let you know that I am here to support you in every way possible. I got to go to another meeting, but I'm going to leave. I think Kitty is on my new foreign policy advisor is on here. Kitty will be on and listen to the rest of your discussion. Please, do not wait for a I don't know what this was, a Zoom or a Blue Jeans. I don't know what that is. But anyway, you do not have to wait for a virtual meeting to get to us. We are working virtually every day. Please reach out to my office. Let us know what your needs are. We're going into the foreign ops, into appropriations within the next couple of weeks. And I want to make sure that your voices are very clear and loud, and I'm going to help you in any way possible. So again, thank you for this opportunity, and I wish you all the best. Stay safe.
Thanks very much, Representative Frankel. We're grateful to have had you for the time you spent. And with that, I want to come back to Roopa, who's been waiting patiently to weigh in on all of this, partly because I know she has a lot to say on a range of what we've heard already. Just as a reminder, too, for everyone, I think there are questions and comments coming in, but please do be sure to send your questions into the Q&A box or chat box if you're more comfortable with that, and we'll get to them as we wrap things up. But Roopa, I mean, you talked about leadership, you talked about sort of women in the workforce and on the front lines. There's just a lot that I think you see when it comes to the disadvantages, unfortunately, of young women and adolescent girls and health and equity. So just wondering if you could speak more to those areas in particular and offer your insights there, and even feel free to respond to what you've heard already around data and around, these the ripple or secondary effects. Thanks a lot.
Yeah, thanks, Lois. And I wanted to step back a little bit and sort of add a provider lens. So I'm a clinician here. I practice in the DC area, and we tend to often separate global health as something being out of our borders. And I think one thing that recent events have really shown is that we need to reflect inside and look at health inequalities, especially health equalities by race within our own borders. And this conversation about girls and women is as important outside the United States as much as within the United States. I have seen young women that come after they have experienced gender-based violence, have been victims of rape 2 weeks after the incident because of not having financial security, fear of stigma. We already know the maternal mortality rate is so much higher amongst Black communities and Latina communities here in the United States. I've practiced in cities like Cleveland and Philadelphia, where we know these numbers are comparable to some of the LMIC countries we're talking about. So I think one thing is also really having this perspective that the agenda that we're talking about is a universal agenda. It's a global agenda to address the position of girls and women, and gender equity is a universal issue, and it's something that is, a mindset that as we are looking at how we're going to be prioritizing our funding here in the United States, really seeing it from, investing in globally is investment locally as well. The second thing I really wanted to emphasize is that girls and women want to be part of the decision making. Angeli, you talked a little bit about part of the Dreams approaches wanting to include more and more girls and women into the design process. We know that if they're not part of the design process, a lot of these solutions are going to fail them. And girls and women are mobilizing during COVID-19. They have formed so many groups. Most of these are unfunded things that they're doing. So let's really also talk about getting funding to local communities, to girls and adolescents, communities, as youth groups, women's groups, to really do the important work that they're doing in creating a social protection network. The third real important is when we talk about building back better, we cannot separate the economic well-being from the health. And as we've learned so, harshly in the last few months, we cannot separate the health well-being from the economic well-being. And so really the marriage between these two sectors is stronger than ever and more apparent. And we need to make sure that girls and women are benefiting economically, are getting to have financial protections, enter from the informal to the formal sector. We close the digital divide. A lot of that multi-sectorial points that were talked about, these are real realities. I was listening to Aya, the African Union youth representative, speak at a high-level panel the other day, and she really talked about youth make up majority of the population on the continent of Africa, and we need to make sure that girls are getting funds, adolescents and young women, to be innovators and to participate as entrepreneurs. And that's also part of building back better. And in closing, I really think, what's been said here, I just want to echo that if we can continue to be gender responsive and say that this is not just about women and girls, when we apply a gender lens and when we have gender responsive health systems and societies, it's going to benefit men, it's going to benefit boys, it's going to address harmful masculinities, and it is also going to benefit girls and women and all the other genders we're not necessarily talking about here, but that's really the future about building back better.
Thanks a lot for that, Roopa. Very much appreciated. And thanks to those of you who have submitted questions. I am going to turn to them now, and again, keep them coming. We have a couple for Angeli. So back on the hot seat, so to speak, but hopefully they're easy enough to respond. We have one from David Bryden, who I know is with Results US, and he's wondering about PEPFAR and other programs that rely on women who are largely making up the community health workforce. I think he's asking a question kind of aligned with what Roopa was sharing in terms of, what we're doing to include them in the process, but also compensate them for those efforts, for that very important work that they do. So just seeking your opinion on whether or not they should be unpaid volunteers, paid with the stipend, paid with full salaries, with sort of opportunities for advancement, and just generally how you can ensure retention of that critical workforce, particularly at a time like now.
Just briefly more, we fully agree that it should not be that people are participating, women are participating, communities are participating on free will to compensate them. Whether it's ambassadors, whether entering where adolescent or where young women are a part of this, whether it's community health workers and whatever focus they have, we are really strongly pushing toward ensuring that they are compensated adequately for the services that they're providing. It's the right thing to do. So that is, we fully agree. I'm not sure if you heard me. You're breaking up here.
We got most of that, I believe. If I could get a thumbs up from other panelists. Okay, great. Got most of it. Sorry for the connection. I think given that, I'll pass a question to Jen, and then I might come back to you, Angeli, depending on your connection. But for Jen, there was a question that just came in from Caitlin Richmond, and I'm sorry I don't have the affiliation here, but just wondering about data in particular. So full agreement around the need for data to inform improvements or advancements in equity. It seems like Caitlin is really wanting to know or get a sense of your insight with regards to any interest in funding pooled analyses of individual patient data. So in other words, data reuse, and in a way that can strengthen the statistical power of decisions. So hopefully you're following that better than I translated it. But Jen, I didn't know if you could speak to Kaiser's interests or even in that kind of pooling.
I think, from my perspective, to provide analysis and information that can inform policy decisions and inform programmatic decisions. So, we are very open to doing anything that can aid in that in this regard. So yes, for sure. One thing since I have the opportunity to speak, I just wanted to say one thing that I didn't get in before, which is about COVID and women, because I think there's been, rightly so, we're all moving very quickly and trying to understand the impact of COVID-19 on everybody in the world. And the data so far definitely show that men tend to have worse outcomes than women. But I think it's important to recognize that from data I've seen for the US, a big analysis just came out, data from Europe, and we have less data now from low and middle income countries because the spread is just really taking off. But the data all show that women are infected at pretty much the same rate as men. It's not that women are not as susceptible to becoming infected with coronavirus. They are. So women are infected at the same rate as men, but they don't necessarily get as sick. But still, in the US, for example, I was just looking at these data this morning, 45% of all deaths were among women. So it is important to remember this is impacting women around the world, and we're just not hearing it and we're not seeing it. So I just wanted to put that out. So it speaks to data and the need to have a better understanding of data in real time. Thanks.
Thanks for adding that, Jen. Appreciate it. Angeli, I want to come back to you if you can hear me all right. We had a question come in from Ambassador Mark Lagan. And this was around, it's really great to hear about the good work of Dreams, and as well as how, it is multi-sectoral and kind of multi-issue. I think he's curious in hearing more about how you all are able to complement or otherwise work with other U.S. programs, and even maybe kind of coincide with efforts like UNICEF's initiatives for around education or other efforts. Can you speak to that?
Sure, thanks. And I think it's a really great question. I think, in order to be comprehensive, we can't just work in a silo, both for adolescent girls and young women, but also coordinating, as Janet talked about, the importance of coordinating, not just among the U.S. government, but across the full breadth of all the programming that's happening in country is really, really important. So how we work on the ground across the U.S. government, whether it's USAID, CDC, Peace Corps, et cetera, but then also within the UN family and other communities that are, maybe part of the education sector or maybe part of the HIV sector, how they come to bear is really critical. I think Malawi is a good example, just, of how that is coming together. They have a strategy, a national strategy specifically focused on adolescent girls and young women. That's extraordinary. Having a strategy that is country-led then helps us all come together around the country in figuring out how do we bring our best to support the implementation of programming across the various sectors: health, education, social, welfare, economic, et cetera, and then bringing all the various partners together. So I think the ambassador's question is really, really critical, and it's complicated, but it's essential for us to work in that way that brings all the UN together and the interagency together, as well as the communities.
No, I like where you landed there, Angeli, because there's a question from Manaz Harrison who's wondering, and this really is applied or can be answered by all panelists, I think, but really asking about the siloed approach to assistance and whether or not we'll ever really solve for that problem, especially given the way sort of the work or operations is structured and in particular given maybe the way the funding flows. So I'd love to hear from panelists how you think we might be solving for that now, or maybe how we have yet to solve for that problem. Let's start with Roopa, because since she was on the back end before, and see if she has comments in that regard.
Thanks, Lois. I'd like to just encourage us to think about how we can make the most with investments, and really echo the sentiments about how can we bring investments from other sectors? So if we're investing into education, how can it also be linked to health, and the same thing with finance and digital divide? So not necessarily looking at every investment in its siloed approach. I know that's very tough, the way that the U.S. government is currently structured, but the more we can go into non-siloed funding approaches and mechanisms. Secondly, really making sure that we are allocating funds in a gender-based way. There are recommendations to use gender markers, gender-based budgeting and financing, and really making sure that that we also have funds allocated to women, especially women of color, women from LMIC backgrounds that are running programs. I'd say even go a step further and make sure that we're giving funds to young women and adolescents, which is also tough to do, and often the way we fund is often in very large portfolios. So thinking about how micro grants can be used to really, again, be more innovative and catalytic in its approach as well. And then finally, I'd like to really say is that really think about how we formalize women and girls' contributions and really introduce girls and women early on to the formal sector. This was echoed a little bit by Maureen about how girls already are missing out on education because of COVID-19 and already pre-existing social inequalities. And we really need to be deliberate about linking health to economic and other aspects of social health and well-being.
Thanks, Roopa. Janet, this was one of your magic wand wishes, right? This idea of integration. So I imagine you have an answer to this question.
Well, I have some thoughts that I'd love to share. We had done some work, for example, taking the point from the Congresswoman about economic empowerment for women and girls, and applauding the new legislation she was involved in and the work that even the Trump administration had put forward on that in that regard. But what we were saying was that if you want your aid to be most effective, which I think is broadly what most policymakers want to see, then it's not in your best interest to just look at this from one small lens. So, for example, if your investments in many of the hard-hit countries, high-burden HIV countries in sub-Saharan Africa, since you have so many health investments there, it makes sense to link your economic empowerment funding to the communities that might be benefiting, for example, from enhanced sexual reproductive health services. Because we know that women and girls need to have access to those services in order to really take advantage of economic empowerment programs. So looking at how is that a bidirectional supportive approach? Why is it important for women who are receiving access to some of the economic empowerment programs to also have access to sexual and reproductive health services? Because we know that in their lives, they are mutually beneficial. But let's look at that. Let's study that. Let's align investments better so that the populations that are being reached are reached with a range of services. It's a sort of a different angle from the DREAMS approach, getting to the same result, that if you want to have the most effective programming, you should align the resources so that the population can access what they need in order to achieve the goals of those programs. And if you don't do that, your aid just simply won't be as effective. So sometimes we get lost in this toxic, polarized environment that says you can't talk about family planning and reproductive health, which defies the data and the voices of people around the world who need those services in order to stay in school and be economically empowered and take care of their families and participate in their communities and be leaders. So we need to look better at why integration and alignment and the mutual benefit of those alignment of programs is in the interest of the investments that the U.S. is making and that other donors are making, and that it ultimately benefits the communities that you're trying to serve.
Thanks for that, Janet. Maureen, we haven't heard from you in a bit, and I know it's getting late where you are. Thanks for hanging on with us. But, I really do want to hear from you how these silos might be breaking down on the ground, really, like where at a local level, if that's even happening, if this is sort of a realistic dream, or if this is, more possible than bureaucrats in DC or Geneva realize. I also would love as well to come back to something that Angeli said earlier about the importance of country-led approaches, country strategies, and really also have you kind of give us a reality check on whether or not that's happening, and if that's really feasible within the current global health context.
Thanks very much. I think I'll start with the issue around working in silos. And this is something that is still happening. We still don't have services integrated well enough, where today I'll go for my sexual and reproductive health services. Tomorrow, I'll go for my antiretroviral treatment. The next day, I'll go for an empowerment program. And so it's just about everyone doing their thing and ticking their boxes and meeting their objectives. So I think, first of all, multi-sectoral coordination is really, really important at country level, identifying and mapping out which different actors are supporting women-led interventions or interventions targeting women and girls, and then trying as much as possible to integrate like-minded services. Like, for example, like for a woman living with HIV like me, integrating services so that it's a one-stop shop. I can go there and be treated for other health conditions. I can also get my ARVs in the same place, as well as information that I need to keep myself healthy. If it's an empowerment program, it could still be in the same place if it's giving information and stuff like that. So I think we need to coordinate more at country level and integrate services as much as possible. And this can be done if donors and the government are very transparent on what resources are available and who is targeted with some of these resources. Sometimes that transparency is usually not very well done. And then it brings us back to the issue of data. So we call it data. It's not desegregated enough. We don't use it a lot to make decisions or to differentiate services. So I think, like someone said, for an adolescent, 15 to 17 years, their needs will be slightly different from a young woman of 21 to 24 years or an older woman by that means. And so how do we ensure that this data is not only collected quantitatively, but also the story behind the numbers, so that we are able to differentiate the services and design programs that respond to the immediate needs of the people in the community. Sometimes we provide women with taps and they want to go to the river so that they find time away from their families and with other women and for them to share stories and to actually breathe out. So I think we really need to identify the needs of the people, engage them in designing those programs, engage them in prioritizing for the investments, and then we are able to now have greater impact than we have now, especially when we design the programs out of the country and then bring them to and start ticking boxes. So that is the first thing. The second one was around, sorry, I've forgotten.
Oh, it's okay. I think you started to answer it even in terms of community or country-led approaches, because I think that's another dream I think some of us have in this space, is that we really see, these initiatives be more locally led, and just wondering what you think is what progress you think we're making in that regard.
Yeah, and some programs really make it difficult for us to access those resources, and they end up working with the bigger NGO in capitals and still don't reach the people who are really, really in need. So I think some of these programs should make it easier for even grassroots networks to be able to access resources, to be able to do the work. And we know that in times such as this, where with the COVID-19 pandemic, women have a lot of roles. We are in key positions to provide leadership in our communities on measures to prevent infection. We are crucial in the public health response and food workforce. But we must be supported to continue in this leadership. So we must see that resources targeting women-led interventions during this season should have flexible conditions for the women and girls networks to be able to access and continue in the work.
Thanks, Maureen. Okay, Jen and Angeli, you guys are going to round us out. Solutions to silos. Go first.
Sure, I'll start. And sorry, I lost connection for a moment, but I'm back. I'd like to think that there'll be some breakthrough in this conundrum that we're always in. I'm not incredibly optimistic, but I do think that there are examples on the ground of where this has happened, including with U.S. programs, and I think it's building on those and seeing how they've done it. What were the facilitators that allowed those programs, those individuals, to make that work happen in a much more holistic way, and build on, take those lessons away. Some of them may be unique circumstances in particular countries with national governments that are supportive of that approach. Others may be very strong, vibrant civil society that is pushing that approach. But there are those examples, and I think we just need to find them and highlight them as much as we can. So with that, I'll leave it at that with the amount of time we have left.
No problem. Angeli, you get the last word today.
All right. Well, just 3 points on that. I mean, I think breaking down silos is absolutely critical if we're going to comprehensively address adolescent girls and young women. And we have to, in our space, right? So we take it from different approaches. So in the HIV world, like we've done with Dreams, together with all of you, together with the adolescent girls and young women, really figuring out what is it that we can do within the HIV world to comprehensively address the needs that adolescent girls and young women have. Where we can't reach, then that's where, Janet, to the point that you raised, that's where we really need to figure out how do we align with other donors, other streams of funding, other folks that have purview, whether it's specifically education, whether it's specifically something else. And then the third piece that I just want to note, integrating services is really, really important. In doing so, though, we need to make sure that we're not diluting services in any way. And so I think that's the piece. We want to remain. We want to address the needs that adolescent girls and young women have, but we want to do so in the best possible way. So again, that's just the third piece that I'd like to state. Integrating without diluting is really critical as well. That's all I've got.
No, I think it's perfect. And with apologies for going over a bit, I want to turn things back to Chris so that he can close us out today. But thanks to each of the panelists and participants for weighing in.
This has been a wonderful panel. Thank you so much to all of you for being part of it. Thanks for everybody who joined it. This was really great. And, I just want to say Friends, and I'm sure all the co-sponsors of this event are really committed to following up on the ideas here and supporting an agenda moving forwards. So let's keep working together and stay in touch on these great ideas. I can't help but note that I think Maureen was introduced as a member of the Global Fund Board. She's also a member of the Friends of the Global Fight Board. We're very proud of that. So thank you, Maureen, for that. It's a really important time, obviously, when a lot of global health responses are being thrown up in the air and we don't know how the chips will fall. So it's a time to be creative and figure out how we need to advance services for women and girls in a comprehensive way. So I think this should be part of just a series of conversations that we all have. Again, on behalf of all the co-sponsors, thank you so much. It was a really great session. And Loyce, thanks for leading us. And with that, see you all soon. Stay in touch.